Uh, my name is Enrique Desmanarias. I am the Marx Chair of Western Hemisphere Affairs and a professor in the Marx School of Public and International Affairs at Baruch College, City University of New York. Thank you for attending today's event. We will be discussing the COVID pandemic in Latin America. As of July 31st, 4 of the 12 countries with the highest number of COVID-19 cases per capita were located in Latin America. These included Chile, which has 1,900 cases per 100,000 inhabitants, compared to the US, which has the most cases, the most aggregate number of cases globally, but which comes in, I believe, 4th per capita with 1,400 cases per 100,000. Peru, Brazil, and Panama also appear in the top 10 globally, with per capita rates of 1,300, 1,300, and 1,600 respectively. Mexico and Colombia have lower per capita rates, but appear in the top 10 cases in aggregate globally. Peru, Chile, Brazil, Mexico, and Panama all appear in the top 13 in terms of death rates associated with COVID, along with the United States, Sweden, the United Kingdom, Spain, Italy, Ireland, and Belgium. Unlike Latin America, unlike Europe, Latin American countries have not seen a decline in general after the first wave of cases. In short, the region has been hit very hard by the epidemic and continues to be hit hard. Some of the contributing factors to the region's challenges with COVID-19 can be attributed to the high rate of urbanization and housing density in the region, intense inequality, and a lack of a social safety net to provide healthcare and income support to citizens in difficult times. As in North America and Europe, in some countries, government responses have exacerbated the challenges created by the COVID-19 pandemic. This panel will explore the COVID-19 epidemic in Latin America, its impacts on the population, and government responses to the disease. We have today a distinguished panel that we've brought together to discuss these issues. Our panelists today include Eduardo Engel, who is a professor of economics at the University of Chile and a director of Espacio Público, a Chilean think tank that has been working on this issue. He held a professorship at Yale from 2001 to 2012. He has published extensively in the area of macroeconomics, public finance, regulation, and infrastructure economics. He chaired Chile's Anti-Corruption Commission in 2015, which led to important reforms in social financial legislation, political party governance, asset and interest disclosure requirements, the selection of high-level public managers, financial sector regulations, civic education, and antitrust legislation. Since March of this year, he has led an initiative at Espacio Público that publishes a widely read report on the pandemic's impact on Chile. Engel holds an engineering degree from the University of Chile, a PhD in statistics from Stanford, and a PhD in economics from MIT. Kenneth Frankel has been the president of the Canadian Council of the Americas since 2014 and was previously chairman from 2007 to 2014. He co-hosts a podcast entitled Two Gringos with Questions with Chris Sabatini of Chatham House. He is a frequent contributor in media and conferences throughout the hemisphere. Mr. Frankel was the legal advisor to the Secretary General of the Organization of American States from 2008 to 2013. He previously practiced international commercial law in Canada, the United States, Spain, and Germany. He has been a visiting professor of law at Ghent University in Belgium since 2014 and has taught at American University and Western University in the United States and Western University in Canada. Mr. Frankel was a Reynolds Fellow with Professor John Womack at Harvard University in Mexico and a Dartmouth Public Affairs Fellow in Mexico and Central America. He was awarded the Queen Elizabeth II Diamond Jubilee Medal by the Governor of Canada in 2013 for leadership on hemispheric public policy initiatives. Mr. Frankel is a senior advisor at Blue Star Strategies in Washington, D.C., and a board director for Global Americans. Finally, we have our colleague from Queens College, Professor Jorge Alves, who specializes in comparative politics, specifically on subnational politics, intergovernmental relations, state capacity construction, and the political economy of development in Latin America and Brazil. His work on Brazil has been published in Comparative Politics, Latin American Politics and Society, and the Journal of Politics in Latin America. He has a chapter on public transparency in Brazil and open budgets, the political economy of transparency, participation, and accountability. Dr. Alves is also a contributor to the Washington Post's Monkey Cage blog. So to get us started, I wanted to ask our panelists first, beyond the top line numbers that I've outlined, what is the current state of the COVID epidemic? And let's start with you, Jorge, in Brazil.
I thank you, Desmond. I appreciate the invitation for, to be able to be engaged intellectually during the isolation. I appreciate the invitation to be here today. I think if we start with a bird's eye view, I think that there's only one clear answer, which is not great. The situation of the COVID pandemic and in Latin America in general, right? But in Brazil as well, in particular, is not good. I think Brazil is only in, if you look at the total number of cases, right, which is, as you mentioned, is about 13,000 per million. It's about, totally it's about 94,000. I'm sorry, 2.7 million, that was a deaths number. It's only in league with the United States, right? Two largest democracies, two largest countries in the Americas, also the largest numbers of cases. The average, rolling average of new cases is also pretty high, 45, 46,000 daily, which is, lags behind the US, but it's beyond most other places. And in league with India, which is much larger, right? The epidemiological curve has kind of slowed down a little bit, flattened down a little bit since June, but it hasn't turned. It's still at about the range where the number of cases is doubling every 2 weeks or so. So that's not so good. Brazil's had the same amount of deaths in total as all of Asia, if you subtract Russia, which is a lot. It's about 1,000 per day, which is, puts it as the #1 reason why people die in Brazil, along with, cardiovascular diseases, which is generally tends to be the top, right? About 23% excess deaths compared to the historical average. Of course, there's variations, subnational variation and all of this stuff. And the strangest thing, or the part that kind of unnerves us the most, is the fact that we know that testing is low. And so therefore these numbers are probably much higher. So, we can go into more specifics, break down this a little bit later, but just to give kind of a bird's eye view, it's not going well. And, it is cause of concern.
Mm-hmm. And Eduardo, can you fill us in on what's going on in Chile right now with regards to the condition of the pandemic?
Well, the numbers in Chile reached very large values, but peaked in mid-June. And since then, they've been coming down significantly. So we have 7 weeks in a row with the number of new cases decreasing. If you take Santiago and its surrounding municipalities, you had days with 6,000 cases in mid-June, and Chile at that time was the country with the largest number of cases. I think not even per million of inhabitants, but just overall, and Chile is relatively small. But that number is now down to 600 or 700. So still high. It still needs to go down further, but definitely we're at the end of what we hope will be the first and only wave in Chile, and beginning a process of deconfinement, of easing the lockdown measures, which began strongly in Santiago in mid-May. And the first step toward a return to what will be some sort of normality till we have a vaccine began a week ago. So in Santiago, you have that. The rest of Chile in the north, the number of cases is still increasing, and that's a source of concern. But at the aggregate level, at the country level, and in Chile, Santiago and its surroundings is more than a third of the population. The worst is over in terms of cases and also in terms of the number of people that died. Chile had very bad numbers. If you look at the aggregate, as you mentioned already, Chile is among the 10 countries with most cases per capita and the 10 countries with most deaths per capita. And it's true that Chilean numbers are more trustworthy than those of many other countries in the region or in the rest of the world. So if you correct for that, possibly the numbers will be a bit less bad, but still overall bad. So even if you make a calculation like Chile is reporting deaths correctly and other countries are misreporting by a factor of 3 or 4, still Chile will be among the 20, 25 countries with most deaths per capita and most cases in the 200 countries or whatever you have data for. So it hit really bad, and I imagine at some moment we'll get into the details of what went wrong in Chile, which is quite interesting and has some interesting lessons. But as a first statement, Chile went through a very bad surge in cases. First, of course, cases, and then came people that died from this. And now things are down significantly, and we're going to go through all the challenges of being careful on the way back to normality, or whatever we can call normality, until we have a vaccine.
And Ken, what can you tell us about what's going on in Colombia and Peru?
First of all, Desmond, it's an honor to be on this panel with you and with Jorge and Eduardo, so thank you for the invitation. If we had run this panel at the beginning of June, and Eduardo just talked about what it looked like in Chile in the beginning of June, I would have said compared to Chile, compared to Peru, forget Brazil, because Brazil is a little bit sui generis, as is Mexico in this discussion, unfortunately. I would have said we're doing great here in Colombia. But that's not the answer that I would give you right now. In fact, we haven't finished our first wave. We're going up, and commensurate with the peaks going up and up are more and more cases. There's more and more testing that's come online, and nobody thinks that this spike will end for at least another several weeks. And hoping that at that point it'll become a plateau. And one of the reasons why Colombia got hit late, as it were, comparatively, is one, because there wasn't as massive testing as there was, particularly in Chile. There was a lot more, and in Peru there was a lot more. Colombia couldn't seem to get its hands on the reagents that were necessary for some of the testing, but a lot of the credit actually goes to the government. In this case, the government has done a pretty good job, and the first case came in March 6th, March 7th, and by the 19th of March, the Medellin, Antioquia, and the city of Bogota were all shut down. They led actually pushed the national government to take much more draconian measures, which they ended up doing several days later. So Colombia, unlike Chile, for example, and certainly unlike Brazil, but more like Peru, went into a draconian shutdown. And I mean draconian, where you couldn't leave your house at all. Then they started to open things up a little bit, and then the cases started to come up a little bit, and we can talk a little bit more about what the cause and effect for some of the government actions have been. But I think the answer right now in Colombia is we're for periods of every 3 or 4 days, we're on severe lockdown where you can't leave your house at all, except if you're in an accepted category. And then there's several days where you're allowed to go to the supermarket once a week, as it were. So we're climbing a curve that the others seem to have, certainly Chile seemed to have climbed, and maybe Brazil. I mean, I guess we'll see how that is.
Okay, thank you. So now I wanted to actually go back to you again, Ken, and ask you about how the public health system is holding up in Colombia, and does capacity continue to exist within the hospital system to respond to the emergency?
Yeah, that's a good question. There's no question. There's no doubt that when this first hit, the health system wasn't capable of handling what could have been the worst case scenario. And part of the early movement by the government in blocking it, in locking the country down, was to try and buy time to build up the capacity in the health system and the intensive care units. So the intensive care beds have gone up by thousands. There have been many, many more ventilators that have been actually invented and manufactured in Colombia for the worst case scenario. It appears as a general proposition that the healthcare system is responding relatively well, given the fact that it was starting from not a great starting point, certainly not, I think, the infrastructure, say, that Chile would have had if you're going to just do a comparison in Latin America. But there were tests were slow to roll out in those kinds of important things. So the general idea is it's standing up, and then when the intensive care beds get to a certain percentage, 85%, they lock the country down completely once again, or certainly they're doing it by areas anyway. So I think the short answer is it's more or less holding up. It's holding up better than it would have happened if we had been confronting this when in March or even April.
Okay, thank you, Eduardo. What can you tell us about how the public health system is handling the challenge in Chile?
So as was just said, Chile had a relatively good health system for a developing country standard. It's always been an outlier compared to our GDP per capita, but it was extremely stressed in May and June and responded pretty well. So units in most hospitals were reconverted almost entirely to intensive care units relatively fast. Some cases, in the hundreds, were flown to different parts of the country when there was not enough capacity in a given city, which was basically Santiago. So it responded well at that level. What Chile missed, and it was, I think, the view of the health minister, it missed the preventive part of healthcare. So when you have a case, you can use the preventive system, which in Chile is really good, to do the tracing, for example. And none of that was done till only a couple of weeks ago. So for many months, it was all centered on hospital and the ability of having intensive care, ventilators. Chile also developed its own alternative to ventilators, which has worked really well and is much less invasive and has fewer sequels on patients. So at that level, there was a lot of creativity, a combination of public and private initiatives in many cases. But all the preventive side, which is crucial when it comes to tracing, was ignored during many months. Some municipalities did it of their own initiative, but it's now become a national initiative and importance only in the last couple of weeks.
Can you tell us a little bit more about the alternative ventilators that were developed?
It's a system of cannulas, which basically help people breathe without the invasive part of a ventilator. It's worked well, and there's a paper right now being written for the IDB so that other countries in Latin America can use it, and looking at the evidence to go through due diligence before that is the case. So that's as far as I know. I don't know exactly the medical detail of exactly what was involved.
Okay, great. Thank you. Jorge, what can you tell us about how the public health system has been handling the challenge in Brazil?
Well, I think I think we need to start from the premise that, Brazil has a public healthcare system that's highly decentralized. So there's a lot of variation in it. And even though it's been a significant advance over, a generation ago, it's typically strained as it is and underfunded, especially after years of economic crisis and everything. So in some cases, it's been working, I guess, as Eduardo had mentioned, it's designed for more to push healthcare towards more preventative measures. And those portions are kind of functioning. But I think in terms of the capacity, in terms of hospital capacity, certainly ICU capacity, that's where you really see the strain, right? Back in May, for example, April, May, some states in the Northeast, which are generally poor, have less installed capacity, were over 90% capacity of ICUs used, right? For some states. Since then, it's kind of declined a little bit, so that now you still have, like 8 or so states that are above 75% usage of ICU beds, for example. But on average, you're about 60%, 62% ICU usage. So you know, so less of a strain than I guess that peak of that initial peak was around May, April, May, June in some cases. Since then, there have been shortages of medicines that are required for ICU, you know, so if you're going to use ventilators and things like that, so you need muscle relaxants, you need, you know, a series of other of medications, and 24 states have reported certain shortages. And the trick with Brazil is this, right? In a decentralized system, the municipalities are going to take the front when it comes to the kind of a primary care, but then as things get more complex, then you need help from the state governments and you need help from the federal government. So how can the Brazilian system be so decentralized and still rely so much on the federal level? It's because the Ministry of Health has the money for new stuff. So whenever something unusual happens, a crisis or this kind of higher complexity stuff, that's when states and municipalities look to the federal government for guidance and leadership. And that's where things have been a little bit strained, right? So even though there's been an emergency package for resources, only about a third of this has really kind of trickled down, even though more of it, relatively a little bit more in terms of transfers to municipalities, about 40%. So, I mean, the public healthcare system is strained. And in some states, of course, much more strained. In certain, the more remote areas in the north regions, in certain northeastern states, as you walk out of the, you know, away from the capitals, that's when you see, you know, the system kind of breaking in terms of it can't support the flow of patients.
Thank you, Jorge. So I wanted to start the next round of questions with Eduardo and ask him, how has the government in Chile responded, and what have been the successes and the limitations of that strategy?
That's a long story. So the Chilean government made, in my opinion, two major mistakes. The first one was it tried to follow a very targeted lockdown strategy, which meant that, say, again, Santiago is composed of more than 30 municipalities, and it would lock down one or two at a time, and then part of a municipality. And the mistake, and this was the committee appointed by the government with experts told it not to do so, and many other experts said the same, but the government was convinced that this strategy would protect more the economy. And this strategy had two problems. Number one, Santiago is an interconnected city. You cannot lock down one part without people moving across to other parts, so the virus just disseminated. And number two, it assumed you had really good data at the very level. And even though Chile tested relatively a lot in April compared to the number of cases we had, it was not perfect either. So you were missing a lot of information. The second mistake came in late April when the government decided to start returning to normal in the economy, while the number of cases was still increasing. So it was at relatively low numbers, but going up and up every day. And we know with exponential phenomena, you must be really careful there. So it gave the wrong message. And by the time the numbers started to go up dramatically, which is the last days in April and first days in May, the government misunderstood what was happening and thought it was that Chile was testing more, which is what's happening in the US now with Trump's argument as well. He's using the same argument that it's more tests and not more contagion. And what you must look at when you have simultaneously more testing and more cases is what happens to positivity, what happens to the fraction of tests that show up positive. And in Chile, they were increasing. And we were very clear from Espacio Público that the government was misreading what was happening. It took 2 weeks before it got convinced of its mistake. And then it began with strict lockdowns. But in 2 weeks, when things are out of control, it's way too late. So those were the two main mistakes, in my opinion. The excess confidence, believing that you really would be able to control at the very local level what you were doing, and it did not work out that way. And then starting to go back to normal ahead of time. And now there's a debate which has elements which are similar to what happened in late April, which is pretty much every group of experts is saying that the government should have waited an extra week or two before beginning this return to normality. It is going ahead a bit too fast, that we don't have a good tracing system yet, which is a major challenge. Having a good tracing system is not easy. That there's been improvements over the last couple of weeks, but it's not there yet. The indicators are not there. In fact, the indicators are not verifiable. The data is not out so that the public can check whether the numbers given by the government are actually correct. which is the case with other indicators. So in general, there's a concern, and I share it, that we might be making the same mistake a second time, which is going ahead of time and should have waited a couple of extra weeks.
Mhm. Okay. And why do you think Chile is jumping the gun a little bit on reinitiating?
Oh, I mean, I think this is the tension between the economy and health. And the belief, which I don't share, but which is held by many people, which is that there's a trade-off between health measures and economic measures. I think that if you don't have the pandemic under control, you won't have normal economy, and that's it. And the comparison between Norway and Sweden is wonderful to make the point. They're very similar countries. The main difference was that Norway had strict lockdowns when things started going bad, and then returned slowly to normality. Sweden had a very laissez-faire policy with almost no government intervention, and the result is 10 times more deaths in Sweden than Norway per capita. But the economy suffered as much in both cases, because with the economy, people are not going to go to restaurants till it's safe in large amounts. So it doesn't depend too much on forcing you to be at home. So I think the government is too much concerned about the economy. It's not that I don't share that, I fully share it, but I think if you wait an extra week, then the chances of a new second wave are so much smaller that it's worth it also in economic terms. That would be my main point.
Okay, thank you. So Jorge, what has the government response been like in Brazil?
I think if we're talking at the national, well, you gotta have to talk about it like that in a federal system, right? Which is the federal government, you know, the national government is expected to lead in a federation like Brazil, right? And that's where I think where it's incredibly haphazard. I think following the lead of the United States government, this example of, you know, there is no real designed national strategy for Brazil. And even though parts of the healthcare bureaucracy would love to kind of take on that role, right? So I think what's happened is, in terms of mitigation, there's been no national policy, and therefore what you have is subnational governments kind of stepping in to fill in those cracks. So, you know, so the municipalities at the front line and state governments kind of intervening, and so, you know, that's the benefit and the cost of decentralization in federal systems, right? Which is, you know, you're going to have some governments that respond quickly, especially those that are suffering more, or that can, or it could be ideological as well. I mean, there's a series of other potential explanatory factors that we can talk about it later, but there's been a large variation in really where places have happened, where things have happened. It's where local and state level governments have kind of stepped in. In terms of mitigation, right? In terms of, I think it's important to say that you know, so in addition to lockdowns, in addition to try to streamline, expand healthcare capacity and all those other kinds of things, one place where I guess led either by Congress or because it's easier to do, the federal government has kind of had relatively better policies in terms of economic intervention. So, you know, there was, you know, so the Institute for Latin American Studies at Colombia has a project where they've kind of been mapping different responses. So the Brazilian government has responded in terms of fiscal policy, in terms of temporarily pardoning debt for states and municipalities. There's been some protections in terms of labor, small business loans, and especially the temporary income of about 600 reais, right, a month, which is, you know, half minimum wage, about $112 a month or whatever. But that's had a significant impact on the informal market and on the poorer population. So if you want to think about in terms of in terms of the mitigation efforts, I think there's been a vacuum by the federal executive, but then the other branches of the federal government, Congress, Supreme Court, and then especially subnational governments have really kind of stepped in and pushed. But then, as you know, in these situations, then you get increased variation, right? You get some places that are relatively successful. You get some places with lower administrative capacity, lower invested capacity that really kind of, you know, those subnational inequalities get pushed, get increased. And we can talk about that a little bit later, because I know there's a question coming up.
Okay, thank you. And Ken, what can you tell us about the responses in Colombia and Peru to COVID?
Thank you, Desmond. Well, there's a lot in what Jorge and Eduardo said, and leitmotifs that would apply to both Colombia, and then if you want to bring in Peru as well, the lack of very aggressive systems for tracing. I think Peru has done better than any of the countries that I know of in that respect. And there have been variations on rolling out of tests and how aggressive the testing has been. Peru has been by far and away the most aggressive in testing of, given the challenges that they have in Peru. It's just a comment. One of the distinctions with Chile, and we'd run a few webinars on what was going on in Chile early on, is for us in the epidemiologists, we had on experts from Chile. No one could understand the Chilean government concept of a quarantine. Just as basically as Eduardo described, it was sort of a bit like a very, very flexible accordion, and even and so flexible that when the first quarantine went into effect. And Eduardo, I don't want to walk on your punchline, as it were, but I mean, I think that when the first one went into effect, the one area that they didn't lock down was the affluent area where the biggest breakout was of contagion, and for some reason that didn't go into effect. So there have been differences in terms of analyzing what the government does. Obviously, there's the health measures, and then there's the business measures. And the same dynamic that Eduardo had talked about, I think Jorge mentioned as well, this what we might call a false dichotomy of health versus saving the economy. You know, clearly that has been, you've heard some of that in Colombia, but by and large, this government has followed the science, maybe more so than most other countries in the hemisphere. And so it's been more or less dictated by that. So as I mentioned earlier, there have been very strict quarantines, and there's no question that has had an effect. How much of an effect, I don't know that anybody will ever know exactly how you quantify that. But the fact that the numbers stayed so low and still are relatively low compared to what had been going on in other countries, I think in part speaks to that. Having said that, there's a limit to what a government can do, and there are pressures that the government faces. And so the government did make a couple of blunders. In one, the view was acceding to the lobby of a very powerful business group. So they decided that for 3 Sundays over this course of, I think it was 7 weeks, they were going to have a shopping day without IVA, without the VAT tax. And when, you know, and this was starting the beginning of June when things started to go up. And so, of course, what do you think happens? People all go to the big almacenes and the big stores, some wearing masks, by and large, crawling all over each other for televisions that were made in one Asian country or another, which the critics said, well, that's a great way to propagate the virus. It gives absolute wrong message. And in terms of really helping the economy, you know, you're not really helping local production of anything, and you're just helping some of the big stores. So while the government declared it an amazing success after the first time, they curtailed the second one and cut out the third one completely. So it was a little bit, you know, the assessment of how well they were doing was basically in their actions. But by and large, as I've said, and there has, as Jorge mentioned, and I think in Chile as well as Eduardo mentioned, the government has come up with programs to funnel money to those most in need. So part of it is based on having a bank account. A big portion of this country is not bankable or not in the banking system. So the amount of effect that had, it was limited to an extent. There's still a big fund that can be used, but according to a recent study, only 29% of it has been given out. And, you know, this is a conservative economic program, government, and well, the Colombian economic program for many years has been quite conservative, and they actually don't really want to give it out. And so, but they are, and they have to. But there is some sense that if the government had been way more aggressive and generous with the money that they were handing out, however they were going to funnel it to these places, that in fact it might have been more of an incentive for people to stay home in a country where 50 or 60% of the labor force is in the informal market, which is, you know, not an unheard story throughout Latin America. But at the end of the day, there is a limit to how long you can keep people living in their homes, particularly if they're living cheek by jowl and they really depend on what the money they make that day to be able to put food on their table at night. So there were some missteps by the government. How grand it affected things to a degree, but I don't think that's really the main story about how the government has handled it. I think otherwise it's been a relatively positive story.
Thank you, Ken.
Can I jump back in here real quick? It's just,
yeah.
I was so concerned with, to respond to something that Ken just said about the approach to science, right? I think I was so concerned of containing potential rents that I kind of moved it too far. I think one of the biggest concerns in the Brazilian approach is how at the federal level, there's been this kind of haphazard and kind of talking against each other, parts of the government biting each other in terms of the approach to science, right? Bolsonaro, like following the example here in the United States, has, you know, emphasized the economic impacts, has sacked multiple health ministers over the emphasis on which science is science and which approaches to take. And you know, we've had an interim health minister now for 2 months, who's an active general from the military, which is not necessarily a bad thing in and of itself, but in terms, it just kind of highlights the instability at the federal level, right? Which has then created opportunities for subnational actors to kind of really kind of take charge and lead things like lockdowns and other kinds of emphasis on masks and things of the sort, right? So I just wanted to kind of piggyback here on what Kenneth has said in terms of approach to science at the federal level is not really where we're seeing it.
Yeah, Desmond, if I could jump in on that. Yeah,
no, go ahead.
Yeah, no, I mean, that nonsense that you see that Jorge just described, that you see that's very prevalent in the United States for all of the world to see, that nonsense hasn't gone on in Colombia. Right, there's none of that. I mean, the federal, the officials, all the local, from local up, by and large. I mean, there may be certain pueblos somewhere where someone has a contrarian view, but by and large, that discussion is completely out. Is not even part of the Colombian discussion. Everybody masks up when they go out into the street. It's obligatory. You have to mask up. No, I mean, there's been way more lax response lately, and we can get into the sort of the fatigue that everybody has been experienced to a degree, but everybody knows that they're supposed to be doing. And you don't hear this massive complaining about our rights are being taken away from us by having to keep social distance when we're allowed out and to have masks. In fact, it's been to such a degree that the mayor of Medellin has asked for every household where there are people 60 years old, everybody in the house, inside the house, wear a mask. You know, how enforceable that is, who knows? But that whole polemic is completely missing from the Colombian, thank God it's missing from the Colombian discourse.
Let me also, Desmond, get back on the economic impact in Chile and the policies by government motivated by what Ken said. On the one hand, there were only 2 or 3 countries in Latin America which really had enough, low enough debt levels that they could really go into debt and spend their ways out of it. And Chile was one of them, Peru the other one, and surprisingly Paraguay to some extent. And yet Chile was very slow in spending money and in also spending large amounts. There was an obsession with targeting the money and getting it only to those who really need it. And in these times, you just get it and lose a bit on the way and miss target a bit, but you want to get it there fast so that lockdowns are effective. If people have to go out to work, they're not going to stay home. And then I'm surprised and interested in what Kenneth said about Colombia, where it sounds like lockdowns were obeyed more than in Chile. There are actual numbers in Chile on how much mobility went down in different parts of Santiago. And in the richer neighborhoods, it went down by 60%, which is good, but still could have been quite a bit more. But in poor neighborhoods, it went down on average by 20%. So mobility is just people moving around, essentially. You can look at the cell phones, and with the help of the cell phone companies, the telecoms, you have that information pretty reliably. So there's also been there an issue. And part of it is, I think, that the government was never really enthusiastic about major lockdowns. So it always transmitted doubt. There was never a good campaign to have people behave in this way and realize that if you do this, in a strict way. It would be a shorter lockdown, and then you can go back to normality faster. It was never real conviction on the side of the government, and you could see that also in the message it was giving.
Thank you
Desmond,
very much. Yeah.
Desmond, just to jump in again, Eduardo, the the scene and the mask wearing and the mobility was more applicable to the first couple of months. And as I think I sort of mentioned, the fatigue or this false sense of security that we haven't gotten it now and whatever it is, and so we'll be okay if we don't. So there's less compliance now with that. In more you know, as you know, called, you know, the barrios populares. Still in the affluent areas, you'll see in people who are listening to the news and seeing what's going on and following the latest science, and like you'll still see by and large 100% compliance by and large, but that's not the case in the other areas. It was more so that way initially.
Just to answer to Ken, in Chile, the numbers I gave was at the beginning. It was at the best moment. Compliance was not that great, and then it deteriorated, as you mentioned. Fatigue was an issue.
So let me move on to the next question. But before I do that, I just wanted to ask the audience that if they have any questions, in a few minutes, I'm going to begin posing their questions to the panel. So if you have questions, please post them in the chat box, and I will sort through them and present them to the panelists. I wanted to ask all of you, you know, getting a little bit outside of the experience of governments, I wanted to begin asking you about how COVID has affected the social, political, and economic life of the people living in these countries. I wanted to start this time with Jorge. How has COVID affected social, political, and economic life in Brazil?
All right, it's a gigantic question, right? So I'm gonna try to compartmentalize a little bit. I think, you know, I kind of framed my response to this question by, you know, there's this author Scheidel that talks about how there's the great leveler. There's the 4 horsemen of the apocalypse, that every time that there's been major declines in inequality in human history, you know, it's war, it's pandemic, it's a series of other things, but it's, you know, so one of the perspectives is, you know, a great pandemic like this should be a leveler, right? Because it would hurt people indiscriminately, and therefore it, you know, I think there's some evidence of yes and no for this. I think initially what we see in the short term is the effects of how pandemics do not affect us all equally, right? And this has already been brought up by Eduardo and Kenneth here, in terms of not everybody is equally free to protect themselves from, or to follow, for example, lockdowns, or, you know, or to keep social distance, you know. There's lots of great coverage in newspapers, including using multimedia to show how in the peripheries of Latin American cities, in favelas, in barrios, people live on top of each other, and they can't really practice social distancing quite the same way. So I think in the short term, I think what we're seeing is that the effects are latching on to existing inequalities, and they increase them, right? So for example, in Brazil, you're 4 times more likely to die from COVID if you're Black or brown and you have lower education. So as opposed to somebody who's white and has a higher degree of education. So that's mapping socioeconomic differences, right? It gets higher by, you know, so it's the incidence of mortality is higher by the browner your skin is, also the lower your education is, in terms of a bunch of other things. Also, if you're in indigenous communities, the incidence is much higher. The socioeconomic impacts in the short term can be devastating, because if you have somewhere in between, I don't know, you know, 20 million people that are in the informal sector and don't have a lot of protections, then not being able to work, you feel those economic impacts, right? Right now, the latest report for the market consensus is that the economy in Brazil will contract by about a little bit under 6% of GDP, 5.7 or something like that. So we haven't even felt the largest brunt of this. Right now, there's a temporary economic, you know, basic income type of thing that has kind of shielded poverty from rising in the short term. But, you know, what is the effect of this in the medium to long term. So I think it has the potential to heighten all these inequalities. Of course, the people who can work remotely, it's the similar situation that we're all facing, right? If I can continue to work from home and my kids are here, then I can protect myself more from contamination than people who are essential workers who need to take the subway, the buses, and this is happening in Brazil or throughout Latin America, especially where you have, a higher level of poverty, lower level of protections. I think there's an argument that can be made in terms of people have argued that in the long term, medium to long term, this can create pressures for government accountability and greater redistribution, which is the Shido argument, right? That if the larger you suffer, then there's a pressure by populations to then force greater redistribution. But I'm not sure that we have anywhere as much evidence right now to support that yet. Okay, there's been some kind of temporary basic income, some other kinds of things. But I think in the short term, what we're seeing is the vast inequalities in Latin America. In the case of Brazil, which is, used to be the most unequal country in the world, certainly the region, but no longer, to see those gains from the last 20 years or so kind of go away.
Mm-hmm. Thank you, Jorge. Eduardo, how has this been affecting the population in Chile in the areas of economy and society?
To answer that question, Desmond, you must go a bit back to October 2019. Chile had a major social protests and quite violent because of a hike of the metro tariffs, followed by the largest peaceful rally in many decades on October 25th. All this led to a November 15 agreement, broadly political agreement on writing a new constitution, or a whole process to lead to a new constitution, which was supposed to begin in April of this year, which was postponed till October now, or in June. It was supposed to begin in June and was postponed now to October for the first vote, in which people will decide whether they want this new constitution. We will then elect an assembly that writes the constitution, and eventually we'll vote on what this assembly proposes to the country. March was expected to be a very, a month full of protests, and of course with the pandemic that did not happen, but the inequalities underlying these protests have not only not disappeared, but become more apparent with the pandemic. If you look at death rates in Chile, they're much higher in poor neighborhoods. They have grown more in poorer neighborhoods. It's not only that poor people often, in general, are more likely to die, but even compared to that, and once you correct for that, it's increased much more in poorer neighborhoods than in richer neighborhoods. Unemployment is much larger in poorer neighborhoods, and just, you go and name it, it's been made very apparent, the huge inequalities. So the question now is, there's a plebiscite taking place on October 25th. And we must prepare to have a safe vote, which is not an easy challenge in times of COVID. And the government has been slow in preparing for this. A number of laws must be passed within the next 3 weeks. And finally, the government is announcing in the last 2 or 3 days that it's aware of this and it will send the laws to Congress. And we will see if that happens and if Congress is fast enough to approve these laws so that we can have, say, the vote in 2 days instead of 1 day and have less contagion, for example. And also we need to have campaigns and we need to have some accountability of who's financing the campaigns. All that has not been legislated yet. So Chile was going through a period of a lot of social unrest with a way out, which was this new constitution, and we will see the extent to which this continues being the best road out after the pandemic. I believe it is, but the challenges are huge.
And Ken, how do you see COVID affecting life in Colombia?
Well, I'd like to adopt pretty much everything that Eduardo and Jorge said. Again, a lot of these dynamics are somewhat similar. There are obviously some differences. One interesting similarity is Colombia too was having some civil unrest last fall, nowhere to the extent that Chile was. But there were things that were brewing for a number of reasons. as were the case in Chile, although there was some, I think, interesting conversation about some of the differences. One of the differences was how the government handled it. In terms of, I mean, we know militarily how Chile handled it. Didn't quite get to that point in Colombia, also because they weren't as violent and as widespread as it were in Chile. But one of the differences I would submit, which maybe has an effect on how they're handling the economic situation or the rollout of relief under COVID, is the Chilean government appeared to acknowledge that they had been too enamored of a beautiful balance sheet and less concerned about actually what the numbers, what it meant for the people. At least in conversations we had, that they realized that they had to do a hell of a lot more in social spending. There was never that acknowledgement in Colombia by anybody in the government. Now, Eduardo would be able to talk more and more about how real that was in Chile, but certainly there were noises to that effect, not here. What's interesting, just from a purely, a raw political thing, is the president of Colombia's popularity rating was, I think, firmly ensconced somewhere in the 20s, and considered to be, the idea was, okay, well, let's see if we can sit and hold this out without too much damage until the next election comes around. His handling of COVID has pushed his numbers up significantly. They've dropped a little bit since the early part of his handling, and we might suspect that they will go down further. I think it would be very naive for anybody to think that those issues that led to the protests in the streets last November have been superseded permanently by what's going on in COVID, and those things will continue to continue to come to the floor and come to the fore and be prominent. Unfortunately, one of the issues is the killing of social leaders. A bit that comes out of the, and you know this very well, Desmond, you've done work in this area, coming out of the peace agreement, has seemed to continue at an alarming rate without any apparent government ability. One would assume there is a will to stop it, but certainly without any real ability to try and stem the bloodshed, as it were, coming out of that. And so that continues on. And economically, again, Jorge talked very, very clearly about effects it could have in Brazil. The thinking here is that the economy, the last quarter, the economy was down 30%. The feeling is year over the year, it could go down 8%. I think probably end up a little bit more than that. Unemployment has climbed to, I had a statistic somewhere, I think it's about 20% right now. It was, before that, it was certainly a lot lower. And there is this general feeling and concern that is shared by the entire region, certainly in this country, and particularly in Colombia, which is still one of the more unequal countries in the region, that there could be a decade of lost progress in trying to close the inequality gap. And so there's no question, as Jorge said, that this COVID has laid bare a lot of the things that have already existed and people already knew, but it's now really becoming very, very quite evident. The question is the concern is, how is it going to be handled going forward? And that's still very much an unknown question, and how that will play out politically 2 years shy of an election remains to be seen.
Thank you. So the last question I have for the group is what do you think the next steps are policy-wise? What should governments be thinking about doing in the coming weeks and months to address the crisis? And I wanted to start with Eduardo on this question.
Tracing. I mean, you must prepare well, and I think one of the main challenges is tracing. And not only governments, but also companies. I think companies have an important role to play if they're given the right incentives, which is to test their workers. You don't need the expensive PCR test. You can do the simpler antibody test. But you want to have a return to normality, whatever we will call normality, until we have a vaccine, which hopefully will be within 6 months or a year. where you can keep people working and having sort of normal lives and avoiding a second wave, and that requires a sophisticated system to trace quickly when someone has a contagion and all the people he or she has been in contact with. I think that's one of the big challenges. It's a major challenge in management. It's a challenge in dealing with people's concerns about privacy. If you want to really trace, you would ideally want to access their cell phones, and people are going to be afraid of how you're going to use that information. Things are made worse in Chile by something I did not mention in the many questions you asked, which is there's a general mistrust of politicians, which goes back to before this government, which is a major issue in Chile, and we could analyze it some other time. But that means that people are strongly mistrust the government. Things were made worse by the fact that the government was very unpopular when the pandemic began and decided this was an opportunity to improve its ratings, and therefore took decisions by itself and did not make a more general process where you involve more people in decision making. So they took a gamble and they lost. Basically, it went wrong. As in Colombia, if I listen to Ken, for many weeks, their government approval ratings went up until things went wrong. And then they went dramatically down because it was the government not listening to anybody else, doing what it thought was correct, taking a gamble and losing. So this is a context as well where you have that people do not trust government, which makes, for example, tracing policies harder because in Chile, the government hasn't even mentioned the possibility of accessing information on people's cell phone to trace those who were in contact with in the metro. And Santiago's metro is one of the important sources of transportation. People are packed in the metro. Once we start returning to normal work, there's no good plan to deal with that. My intuition is that just wearing masks won't be enough. And I'm not sure if the government is really thinking about this at this moment that careful. I'm sure they are, but I don't see an easy solution to that challenge.
Okay, thank you. Jorge?
It's a difficult kind of thing, right? Because I don't want to overestimate. Political scientists tend to overestimate the importance of the public sector, the state, to do everything, right? But ultimately, it's individual level behavior. It's individual behavior, collective behavior. It's voluntary compliance that solves these things, right? And as Eduardo mentioned, what do you need for that? You need trust in the public sector, and you need trust. And I think that's one of the things I didn't get a chance to talk about in the previous question, Desmond, but I think one of the costs of this is that it has heightened the culture wars and the polarization in much of Latin America, but also in the world and in Brazil, and therefore, you need, in a decentralized system, for it to work the way that you need. Everybody wants decentralization, but you also want support from the national level that has more financial power, but also has more capacity in general. So you need support, you need a clear message from the national level, working in an organized fashion with one voice, hopefully backed by science, so that you can then get people moving in the right direction. I think there's been significant compliance, despite the fact that, not quite what Kenneth has described in Colombia, but I think there's been, even though, there's been all this dissemination of stuff in WhatsApp and other social media, I think in general, people have been complying, those who can. I think, of course, those who are poor and aren't as protected can't comply as much as they would like or even consider those things. But I think the critical thing is, on top of the other things, like making sure that the money flows in the way that it's been promised, in the way that, so that you have support for local governments. I think you need to have a united, or at least rowing in the same direction from the public sector, and that comes from the national level. Brazil is not in an election year like the United States, right? It's a local election, which some people have argued that that's what's giving extra incentive for mayors to really kind of perform on this. Maybe what we'll see is that, depending on these results at the municipal level, this will send kind of a midterm election type of signal to the national level to see what kinds of compliance you're going to get. But I think the number one thing is making sure that people can know which position to trust, right? And It helps if it's one united or at least generally cooperative voice.
Mm-hmm. Thank you very much. And Ken?
Yeah, let me step in. I think I may have painted a little bit too rosy a picture of compliance in Colombia. So just for the record, Colombians are known to be rumberos. Colombians like to party. And so I mean, early on, there was big outbreak in Cali, capital of salsa. Now you see, and then there was along the coast in Barranquilla, Cartagena. Now you see some of the big areas are these places sort of between Medellin and the coast, but sort of a coastal mentality, Monteria, Sincelejo, and you say, how could that happen? Well, you know, parties, police are going in, breaking up parties with a whole lot of people and the like. So, and then those aren't the only places that's going on. So I don't want to, I'm not trying to paint it as Boy Scouts and Girl Scouts in terms of compliance. That this certainly has broken down in places. Just the other thing is, and what George is, this has not broken down into a cultural war thing at all. And God knows if there's a country that is polarized politically, although there's a much bigger center than people think there is, that polarization hasn't coalesced around this issue. So you have people on the left and people on the right having a conversation more or less about what the science is, and a little bit about, and the tension is a little bit about, well, when do you start opening, how quickly do you open up? But I give high marks for the government for really resisting the temptation to move away from that. So in terms of were I in a situation where I were advising the government, I would say keep following the science and listening to the people who know these issues. And a subcategory might be, which is something they don't want to go to, which is something that other countries might want to reconsider the system that they put into place last year, where there were tax breaks for companies and others who many people think now should be paying more money into the kitty to help pay for the social spending and everything else that's required.
Mm-hmm. Thank you. Now we're going to move on to some of the questions that our audience has asked. A question that Maria Rodriguez Ferreno asked dovetails very nicely with something Jorge said a few moments ago. She asked about corruption amid COVID-19 in Latin America. And Jorge had said, well, you know, one of the big issues is public trust, right? And that's a really essential element of this. I've been conducting some research in Colombia telephonically over the past couple months. And for example, in Putumayo, there's been a lot of people say that the government, that the local government, the regional government is sort of driving up COVID case numbers so that it gets more payouts from the state. And I don't actually think this is the case. I think they have a very serious COVID problem in Putumayo, but clearly there's a lack of confidence there. It's embedded in this idea of corruption. And I'm wondering if we could talk a little bit about sort of the issue of corruption amid COVID and how that's impacting response in different countries. Maybe we can start with you, Ken.
Thank you, Desmond. Look, there have been reports about corruption, people taking advantage of it in Colombia, but every single day there are reports. I mean, Colombia has it's every single day there's a new scandal that's coming up with respect to corruption. And so unless I'm not paying as close attention as I should be, it doesn't seem to me that there are a whole lot of this whole new font of corruption cases that are coming out every day related to COVID specifically. There are about guerrilla paramilitary or armed guerrilla activity moving into where there are voids, but that's a bit of a continuation of before, but not in any great scale that have been covered so far.
Okay, and Jorge, do you want to speak about this?
Well, I'll just say something kind of briefly, because these kinds of crisis situations are often create opportunities for corruption, right? If you think about the political economy of corruption as not only the demand, but also the supply or the situations in which you have opportunity. So all of these situations where you're going to have to buy a lot of stuff, the public sector is going to have to buy a lot and distribute a lot of stuff in a short amount of time. Often you're creating exemptions to public bidding and all that kind of public transparency stuff is a great opportunity for people to, you know, at the macro level and also at the micro level in terms of distribution of stuff to proliferate. And chances are, because of the urgency that we have, a lot of these things won't show up for a while. I mean, I know that there's already some, you know, the Ministério Público in Brazil has already started spotting, and the federal police spotting, you know, and trying, you know, not necessarily reaching trial yet, but, you know, different accusations, investigating accusations for different governors and also mayors and a series of other things. So I think it's not unusual that you would see that, right? Because you're seeing a situation where there's significant pressure on the public sector to move quickly, right? Because then you're damned if you do it, you're damned if you don't. And then there's always going to be opportunists in these kinds of situations that are going to then take advantage, of course, to, you know, channel supplies or hire the people that are going to give kickbacks and in a series of other things. So I wouldn't be surprised if there are, right? And then it all depends on, you know, how much does the public actor actually trust the government to do the thing that it's demanding that the state do, which is to facilitate and to move quickly, to get ventilators to hospitals, to expand, you know, ICU capacity, to, you know, I'm gonna stop short of, you know, doing the whole, you know, blaming either victims or specific actors. I think this is the kind of situation that's ripe for corruption to proliferate in the short term.
Thank you. And Eduardo, do you have anything to add about corruption and trust in the public sector?
Just to insist on what George said. I fully agree with George that at times of crisis are times where normal procurement rules can be skipped legally, and that's of course a major risk of having corruption. Let me add to that you also want to be careful about anti-monopoly or competition laws. It's also times where people might collude easily. So all the parts of the state, national controllers in many Latin American countries, which are in charge of preventing corruption, and other agencies should keep the work and get extra resources in these times so that they can act as a counterbalance to the natural possibility of having more corruption just because you're skipping many of the rules legally, because it's time of crisis and you want to get something fast.
Thank you. I wanted to move on to another question that was asked by one of our audience members, but whose name wasn't attached to it, unfortunately, which is looking around the region. Do any of you see cases where you think countries have responded particularly well or adroitly to the crisis? Eduardo?
Uruguay seems to be the case where you look at the number. I don't know exactly all the details, but the numbers are spectacular. And we know that Uruguay is a country where you can trust the numbers. Often when you see good numbers, the next question you ask yourself is, well, can I trust these numbers? But Uruguay, together with Chile and Costa Rica, show up as the three countries in Latin America which usually have better institutions, better governance, and all these rankings. And Uruguay's numbers are spectacular. They have not had, under any definition, a first wave. So the numbers never grew enough to make it to a first wave, and it's been an important success story in terms of how they've been handling with the pandemic so far, and I hope it continues like that.
And I think, Desmond, that ties into a comment that Eduardo made earlier, or I think maybe, or Jorge, that I think one of the reasons for Uruguay is not only have they followed the science, but there's, I think, a much greater trust in the government and government institutions in Uruguay than there are than probably, I think, than any other country in the region. And that has definitely had an effect in their efforts to battle this.
Thank you. Jorge, do you want to add anything to this?
I think I'm fine with what Eduardo and Kenneth said. I mean, Uruguay is an outlier for most things, right? And I think I'm good with what they've contributed.
Excellent, thank you. Remy Balareso asks a general question about inequality and migration in Peru amid the economic downturn. So I wanted to ask sort of two separate compounded questions here. One is the impact of this on migration, right? Is there migration happening in countries? Are people moving around or seeking to move out of countries because of fear? And the second question is the broader economic question, right? What are sort of the forward-looking risks to economies? For example, Joseph Stiglitz and Hamid Rashid wrote an op-ed a couple of days ago in The Guardian about the risk of a debt crisis emerging out of the economic crisis of COVID in middle-income countries, which characterizes a lot of the countries that we're talking about here. Maybe we start with you, Georgie.
I think there's a great report in the New York Times, I forget exactly when, about where they were talking about how migration numbers have plummeted, right? So certain towns in Mexico or certain parts of the route that comes from South America through Central America to the United States have kind of trickled down to slow down to a trickle type of. And I think that makes sense if people are scared, right? Even Venezuelans that had walked down towards all the way down to Peru and Chile and things, there was all those reports of Venezuelans walking back home. And I think the fact when the economy is kind of tanking everywhere, and if people are trying to find an opportunity, they'll go back or they'll stay where they are, right? So I think in terms of migration, it seems that the initial kinds of reports are that it slowed down quite significantly. But I think in a situation where if the economies of course pick up and some pick up faster than others, then we'll see that pick up again. So I'll focus on that first question, and I'll leave the other questions for my co-panelists here.
Okay, Eduardo?
Agreeing with Georgia, I've not seen aggregate numbers, but based on press reports, it's been full in Chilean newspapers with groups of migrants going back to Bolivia, going back to Venezuela. And that's going to happen all over the region. Once you have high unemployment, these migrant workers, unless they're legally and already have all the papers, are not going to be very welcome, and they're going to be forced to go back home and possibly even want to go back home. So I think that might be quite a massive process over the next couple of months and years. Regarding whether this will lead to a new debt crisis, I did not read Joe Stiglitz's op-ed. It's not obvious to me because under the assumption which most people tell you that we will have a vaccine which is massively available within a year at most. I think that's sort of the basic scenario. I think you can have a good comeback. The level of debt will be high only in countries which really were able to go into a lot of debt. The rest of countries had to go to the IMF and ask for help because no one would lend to them that much anyway. So I think that it's hard to tell now, but I think that we should be able to, once we have a vaccine, to return to a sort of normality also on the economic side within a given time. And the challenge will be, and George is there, the person together with Ken, the politics of it, of course. Productive ability will be back, but how will you deal with political events unleashed by the pandemic? And that, I think, may also vary a lot from one country to another. We've mentioned Uruguay as one example. Chile is in a very particular situation, and there are many countries with other specifics to them as well. Brazil and Mexico with populist governments of different sorts, where it's again going to be a major factor. So that, I think, we might have also quite a bit of heterogeneity across countries in the region.
And Ken, what would you like to add to this?
Yeah, first of all, there's no way I'm going to, having our distinguished economist just make a comment about that, there's no way I'm going to make a comment on that. He's got the last word on that. In terms of immigration, Colombia's absorbed over the last several years close to 2 million Venezuelans, and admirably so, without xenophobia, by and large, and integrating them into the social systems here, however good or wanting they may be. I'd seen some reports about some going back to Venezuela, just as Georgian mentioned, or maybe Eduardo mentioned about some. There's the one story that everybody was seeing about in Peru, Venezuelans going back from Peru to Venezuela. But by and large, that is not something. There's no mass exodus of Venezuelans from Colombia to Venezuela, as far as been reported anyway.
Okay, and just to follow up on the Venezuela issue, I don't know how much you're following this, Ken, But Denise Zekele asks about Venezuela's response and how the situation's been evolving there.
Yeah, I must say I'm not following Venezuela closely. Others are. What I do hear about it, and with the webinars and people have done, is it's not a good situation. Whether or not it reaches the catastrophe that's gone on in Nicaragua, I don't know. But I don't get the sense, and I don't think that anybody puts any credence in the numbers that Venezuela is putting out either. So, I mean, that's as much as I can say about it without saying something about which I really have no real direct evidence or real knowledge.
Mm-hmm. Excuse me. Julia Rodriguez asks about the impact of COVID and the response to COVID on basic human rights, particularly in sites of state fragility like Central America. We haven't talked a lot about Central America, but certainly in the ongoing work I've been doing on Colombia, I've noticed a lot of tensions around basic human rights issues. So for example, in Putumayo and Urabá, but also in Rio Shanty towns, a lot of armed groups have become involved in trying to maintain order, trying to maintain public health norms, and it's gone so far in some cases as to have people murdered who have violated movement restrictions in certain areas. And I guess let's start with you, Ken, on this issue.
The answer is yes. I mean, that seems to be a phenomenon that's going on. Look, one of the problems in Colombia since the beginning, before it was even, or depending on how many centuries you want to go back, but certainly something that was very, very pronounced and a critical element of the peace agreement, was the fact that there are vast areas where there's no real, or has never really been, as they say in Colombia, presencia del Estado, presence of the state. And so when that's the case, and there's vacuums, people fill those vacuums, and generally they're not the most altruistic elements who are operating. But that is an issue, and there's no question, as I mentioned earlier, that there's still an alarming rise of murders of social leaders, ex-FARC commandos, or people are settling scores with, etc. So this crisis has certainly not helped in that situation, and I suppose, given some of the reports and what we're seeing, the argument could be made it's actually exacerbated it to an extent as well.
And Georgie, how do you see the implications of COVID and the crisis and the state response for democracy in Brazil?
Let me so in terms of civil rights, right, or basic human rights, I think every time that the state tries to have a public health intervention, a major public health intervention, it can become quite kind of totalizing, right? Brazil has this history going back hundreds of years with, in Rio and, the vaccine revolt and all those other things. Like, I think one of the things that I learned, but I couldn't quite mention while I was doing fieldwork in public health in Brazil, is that public health, in its desire to save the world, is somewhat totalizing. It is kind of, it should take over all economic concerns. It should take over all the other concerns. And of course, that's not realistic, right? Politicians and everybody else, there's a series of other concerns, not just health, right? So I think it's normal that there would be a pushback, just like there's discussions here in the United States, sometimes a little bit past the point of reason in terms of where do my freedoms end and yours begin and all that other kind of stuff. I think it's natural that in a democracy where people have the right to express themselves, that they would push back against that. I think these discussions, as I think Kenneth mentioned before, is like people are more willing to accept, maybe because they have a longer history of the government intervening in their rights. They take less for granted, so they'll follow a little bit and then they won't comply in other ways, right? I think to the extent that it's been kind of heating up the cultural wars that have been occurring in Brazil, much like in other parts of the world, I think it's potentially dangerous for the kind of the willingness to get along that democracies require, right? So that you accept the other, sort of pluralism, for accepting the other as as a respectable member of society and differences of opinion. But one of the things that I will say, though, is that Bolsonaro, for example, had this idea that there was a floor for support, that Bolsonaristas were 30% of the population. And I think what the presidential popularity ratings have shown is that that floor is not really as high as people thought. So, for example, the popularity for Bolsonaro has continued to decline and is now, if you take an average of different polls, and I think Nexo or Revista Piauí kind of did a thing where they kind of aggregated polls like 538 does, and it's around 26%, the popularity for Bolsonaro right now, the lowest it's ever been. And it's continued to decline, right, over the course of the pandemic. So I think what that's showing is that to a certain extent, the population perhaps is not as divided as you thought. And when it comes to feeling the real impacts of a pandemic, then people eventually certain people start making up their minds that it's like, all right, well, I might be okay with all this other stuff, but when it comes to real fear of death or experiencing these things in my community and whatever, then people start to break away a little bit. I know that there's been some whispers, or not so much whispers, at certain points of like, is this an impeachable offense? There's been some of that stuff. Has Bolsonaro then kind of gotten closer to the center and changed his language a little bit, of all that other kind of stuff? I don't quite know. I think we've been having, year after year of a not particularly hospitable time for liberal democracy in Latin America, and a little bit of a retrenchment, if not fully, but certainly, not advancement. And I think it's too early to tell. I think there's some indications that the fire burns hot, and that kind of polarization is still here, but there might be also something traumatic enough that maybe is moving consensus, at least in Brazil a little bit. And I think that's as far as I'd be willing to go.
Mm-hmm. Okay, great. Thank you, Jorge. And Eduardo, you're going to get the last word here. What do you think the implications are of the COVID epidemic for democracy in Chile?
Well, and human rights you had mentioned too. So what happens in Chile is with social unrest last October, the police were accused of human rights violations, and with good evidence. Human Rights Watch had a devastating report, for example. So this was compounded, the loss of trust in the police, which had been involved in corruption scandals a year earlier. Chilean police was considered one of the few non-corrupt police in Latin America, and that was gone as well. So what that mean is that you need a major reform of the police, something which many governments had sort of been avoiding to do. And now you have the pandemic, and you have a police which is not going to have any trust from people in enforcing it. They have not done much in enforcement because they're afraid, because people are really don't trust them at all. And then in poorer neighborhoods, there's a lot of talk. I don't know if this is really important aggregately, but many press reports and anecdotes about poorer neighborhoods where there's not been police there. You have had that drug lords have sort of taken a more preponderant role under the pandemic. Chile has a state that is present most in the country. It is far from Colombia, as I learned from Jim Robinson years ago. But still, even in Chile, there are poor parts of Santiago where the police has not gone in many years, where it's really dangerous to go in, and where drug lords have become the presence where the state is not present. So the extent to which that might grow during the pandemic is something we will know only in the future.
Fantastic. Well, thank you very much. Thank you to the audience for attending our event, and thank you especially to Eduardo, Jorge, and Ken, as well as Diana and the team at the Mark School for helping put together the event. I've learned a great deal, and have a good afternoon.
Thank you.
Thank you. Thank you.